Yeah, so we would like to acknowledge Larrakia people as the traditional custodians of this land and waterways and the seas. We respectfully acknowledge the elders and the custodians past, present, and the descendants and kin, and honour this country where we stand today by sharing and learning together. So I'll just get both Emma and Michelle to introduce themselves.
Good afternoon. I'm Michelle McMasters from Alice Springs, born and bred from Alice Springs, but family ties are from Roper River and Borroloola. So I'm the Healthy Housing Officer for Congress.
And good afternoon, my name's Emma Stanford. I have the pleasure of working with Lesley at Minimbarring, part of the University of Melbourne, Indigenous Eye Health Unit, and work closely with Michelle, the Healthy Housing Officer. We also would like to acknowledge our partners here that are involved with funding the Healthy Housing Officer role that Michelle has, and also acknowledge that we have another Healthy Housing Officer at Catherine West Health Board that we also work with, and also we'd like to acknowledge the funders of that, thanks to the Fred Hollows Foundation and the Rotary and Trachoma for their funding.
Okay. Partnerships and opportunities. It's quite important for us all to sort of work together as partnerships. One of the things that both Michelle, Emma and I actually do is that we make sure that it's community-led, and by saying that it's the needs by community, and also with the Aboriginal Housing NT. More inspections and maintenance. Oh, there you are. Sorry. I went on to the next one, sorry. So yeah, housing and working together, more inspections, planning, maintenance work, workforce, healthy housing officers, and very similar, nachos and AMSANT and NT members on the grounds looking for housing employment, particularly employing the local mob. There's also links, referrals through the clinics like Western Australia, but also the work that Michelle does as well with Congress, empowering the community, involving in the solutions, healthy homes and healthy people. As you noticed, we wanted to go to Willajunta next door because they explain the right way for the housing guidelines as well. So it's all about growing an Aboriginal and Torres Strait Islander environmental health workforce, which is to us is the best practice, and learning to work together for better outcomes. Okay, prevention and elimination. I actually work in this space as part of the Trachoma Indigenous Eye Health. So sustaining elimination of trachoma in Australia requires a full implementation, and just recently the World Health Organization has had a safe strategy, which I was working in with, and then also with Michelle and Emma. So it's all about facial cleanliness to stop transmission and access to safe and functioning bathrooms, and washing facilities are the key to this best way of doing things.
So as Lesley said, we've been working in eye health for a number of years and had the pleasure of working with Congress and many other of the community health organisations, including Catherine West. It's great to be here at a housing conference because, as we've been hearing, housing has everything to do with health and wellbeing, and we've been able to work a little bit, as Lesley said, under that SAFE strategy. That it's interesting to note that the elimination of eye disease involves environmental health and has done for a number of years. So we've tried to use that as much as possible to be able to work in this space. And it's great to announce here that on the 29th of April in 2026, Australia became the 30th country in the world to eliminate trachoma as a public health problem. That's something that means a lot to us, having worked in the area for a long time, and also to all the communities that have worked so hard to do that. This is fantastic, but the thing is, you need to keep it going. We don't stop now. We don't say, oh, well, we've done it, so that's it, tick. That's the thing. There's lots of good work that's happened, and we need to keep it going. In fact, we need to strengthen it. So that's why we're so pleased to be here. We've got to keep that pressure on the spring. We've got to keep those clean faces and good hygiene practices going, which Lesley will talk a little bit more about soon. And Michelle will also talk about how she's helping out keep those taps and showers working, which is impacting people's health in such a positive way. We also wanted to mention, which has been mentioned quite a lot at this conference, all those determinants of health that the World Health Organization and others talk about, and how much outside of health accounts for people's health and well-being and those health outcomes. I think we all know this, but it's good to have those stats there and be reminded. It's not all about what happens in the clinic or what happens in the hospital. It's a lot of what happens in the rest of your daily life that impacts on your health and well-being. We just heard about lots of climate impacts on people's health in the most recent presentation here, but that's really important. And just to build on that, we spend a lot of our time working, as we said, in the Northern Territory. You've had more than 7 climate episodes so far this summer. And something that Dr. Simon Quilty, who's presenting over with Willia Junta in the other room at the moment, talks about is that the Northern Territory government, outside of Tasmania, have got the lowest requirements for thermal efficiency in any Australian jurisdiction, which is quite frightening when we think about the housing conditions people live in. And all the other issues that have been covered as well today about those power outages and things, they impact on people's health and well-being, including the homelessness rates, but also the crowding. And that's just a house that doesn't suit the way people want to live. It's not the people living in the house that's the problem, it's the way the house is designed. And we're very focused, as we've said, on health hardware, because we need that constant repair and maintenance, the planned and cyclical maintenance that means that those resources are protected and they work. And again, over in the other room, they're talking about this now, but we think that this sort of summarises in the most sort of clear and concise and strength-based way all the things that need to happen. And we recommend this document to you if you haven't seen it. Those design principles there, all of those 7, that's what we need: the community-led, culturally appropriate, design for environment and climate, design for health, build the right way, designed to be maintained, really important. You can have a new house that in 3 months' time can look very similar to some of the old ones if it's not maintained. And also that ongoing evaluation and learning, super important. Now I'll switch back to Lesley.
Okay. So as you see, actually on your tables I left some goodies there for you to take with you. But my role is about the education around Melbourne's 6 steps. In Central Australia, Western Australia, in the remote areas, they all know who Melpa is. Melpa is our mascot, round, clean faces, strong eyes. And as you see, I actually do education in schools. I talk to community members about the hygiene practices as well. So as you see, step 1 is all about blow and nose till it's nice and empty. Step 2, wash your hands with soap and water. Step 3, clean your face to get away the snot and the yuckiness around your eyes. Brush your teeth every day. Have a shower every day as well with soap and water. I actually like to do a little jingle when I'm doing this sort of exercise, particularly when it comes to kids, because they think it's hilarious, but they understand what I'm saying as well. And of course, don't share towels. It's really important to explain to kids that if you get a towel, which I normally go into communities and I give them a little pack of having, apart from the resources, they have a towel, they have soap, they have toothpaste, toothbrush, and tissues, because we're going through these steps with them, and that's what they take home with them. And of course, as I always say to the kids, how does Melpa sneeze? And that's always away from your body. So they're the, and not to mention that, when I talk to the little kids, I also talk to the adults, talk to the older kids as well, because they're the ones that actually can teach and help our little ones to make sure that they don't have a snotty nose, or they know how to wash their face and their hands as well. Okay, on the table, we do have a flip chart, and as you see, part of this flip chart, it's fairly brand new. It's all about Melbourne's 6 steps, but it's also around the health of homes as well. I've actually had the privilege to do the artwork for this flip chart as well. And what I'd like to, if you have the time, have a look at the flip chart, give some feedback if you can. There is a barcode on your table as well, but it's all about what's included in the flip chart as well. So as you see, there's a part there where we do talk about the health of homes and help keep families healthy and strong in their homes. So this is just sort of some feedback that we'd like to know about the actual flip chart, whether the messaging is the right messaging or if it's not, or if we can put something else in there as well. Healthy homes, one of the great privilege that I've been doing is actually going into communities. I do talk about health of homes with community members. It's all about the safe bathroom checklist. This is the tool that I use. I like talking to the kids about it too, because the kids will tell me what's happening in the homes. Adults won't, but the kids will tell me. And then what I've actually done is, the safe bathroom health checklist. We've got the health of home officer, which is what Michelle does. I do workshops around the cleaning tips. As you see on the tables, I have left some of the cleaning tips there. And in my presentations, I actually make non-toxic cleaning products with the community members, which they take home with them. They also give me information. They give me tips as well. So it's that sort of yarning, but also learning at the same time. Community health days, I do a lot of health promotion around it all, working with adults, education, schools, and also community meetings. So my role is really, really important, but it's just some of those things that I enjoy doing. And it's a good way to talk safely and culturally safely with tenants, because sometimes tenants won't let you in. But one of the things that both Michelle and I do is basically I just tell them, hey, we're only here to talk to you, we're not here to judge you. So, and that's how, we just managed to talk to the residents, but, get good feedback from them as well. You're going to talk about that. That's your baby. It's yours.
Right, I'm Michelle, like I said, I'm the Healthy Housing Officer for Congress. I work on 6 communities outside of Alice Springs, which is Mungana, Sanitaries, Imampa, Mutijulu, Arionga and Hermansburg. So they're the 6 communities that I go out, and I use the Fast Field app that I've got on my iPad, and I do audits on each and every home in those 6 communities, but I've still got a long way to go. Once I do, when I'm communicating with the community before I go out, I send out, that's my poster that I try and send to community to let them know I'm going to be on community and what I'm going to do on community. So I do audits on their homes, check their bathrooms, toilets, kitchens are the main areas, and laundry, and plus there's another bit on the app for other areas, smoke alarms, whatever else is not working in the homes, and then I report all that to Territory Housing Maintenance, and I also attach all the photos and small videos if they're leaking taps or busted pipes from underground, so they can see how bad the problem is. Keep track of everything. I've got a spreadsheet for each house, and then I'll do follow-ups. So I'm always doing follow-ups. I never stop, so just follow-up after follow-up to making sure things are getting fixed. If they're not fixed when I go out to community again, I go back and I send another email for another follow-up to see when the problem's going to get fixed. So that's basically my communities, how many audits I've done so far. follow-ups, outstanding requests that haven't been fixed. So then I do another follow-up, go back, check if it's fixed. If not, so it's just going to be ongoing. So, yeah, I think. And once I've done an audit, I give them a pack for letting me inside their homes. I don't just walk in either. I don't toot the horn when I'm going into their homes. I just check who's out, and I'll walk in and introduce myself as well, and what I'm there for. And like Les said, you know, some of them get shame and don't like us in their homes, but once I tell them what I'm there for, they welcome me in. So at the end of each audit, I give them a pack which has got a set of towels, shampoo, soap, washing liquid, just a little thank you gift for letting me into their homes. Yeah, so that's my job.
So Michelle gets great feedback, and she didn't want to do this one herself because she's too modest. So she's got a wonderful way of engaging with the community, as we've been talking about, and she got this great feedback. So there was a reading here. So she visited a tenant in their community, and they were talking about the fact that it had no hot water during the winter. So this is in the desert in the winter. For months. So that also, Michelle reported the back fence and the front door issues, and they were all fixed within this week. So this person was super, super happy and sent a message to Michelle saying a big thank you for her efforts and determination, making sure that the hot water was fixed. Now this family can have a hot shower in the morning. They used to have to boil something on the stove to have a bath. So, and also that the backyard and the door was fixed. And just lovely feedback from someone. So as we can see, that strength around getting something fixed and having something done about an issue is huge for people, as you can imagine. Do you want me to keep going with this? Or? So we were really pleased to be here today to be able to present with you around all this work around healthy homes and healthy people, because we really think they're linked together. They go hand in hand. And as has already been spoken about quite a lot, that community leadership and involvement in the solutions is just vital. It should be, can't go past go without it. We want to see more of housing and health linking up together. We think that's important, and we heard an earlier presentation today around a possibility of linking up Communicare, which is the health system that all your information gets logged into when you go into one of the health services, providing potentially a flag for a public health flag. And we've been talking about that for quite a while. It happens in WA. They'll provide a referral from the clinic to environmental health, but it's not happening in the Northern Territory and in other jurisdictions, and we think that that's another opportunity. As Michelle says, we really need more inspections done. There's not enough done, and they need to be really regular. I know it was spoken about yesterday that planned and cyclical maintenance is going to increase, so we'll be glad to see that, but at the same time we need more inspections done. Michelle's done 7 follow-ups in some of those houses, but the thing is, she can't stop. She shouldn't stop. She's got to keep going, because, you know, everyone's house needs to be maintained. It's not like you maintain it and then you forget about it. You've got to keep going at that. So we'd also like to see a reference number from housing to log the job so that someone's got something to refer back to, and then we can track how long it's been taking to get it fixed. We know the health habitat data in the NT shows that only 3% of issues are actually being reported. So that reporting system is super low. It's not capturing what people are experiencing in their houses. The great news about trachoma being eliminated is wonderful, but we want to sustain and make sure that we build on this. We've got Milpa, a very fantastic mascot, and we want to make sure that those 6 steps and those other good hygiene messages continue into the future. And in order to do that, we need to have the taps and the showers and other things in the houses working, linked to that repair and maintenance. And we also just wanted to highlight the wonderful example of Willia Junta, and there's a great video of that amazing house in case people haven't seen that. So we've also provided our contact details, but if anyone would like to talk any more about that draft flip chart, please click on the QR code, come and see us, or we can email you a link as well. So thank you very much for listening to us, and I don't know if we've got time for questions. Yeah.
I just have a question. First of all, thank you for your hard work, for what you do for our mob. Just a question, when you report these issues to housing, what's their turnaround time frame? You know, do you collect data? How long does it take them to repair what you've reported?
It can take anything from week to months. I've been out, like I said, a couple of times, could be 2-3 times, and the job's still not done, so I'm just constantly...
Do they do it on priority, like if it's electricity
Well,
or no water?
depends, yeah, on priority. Also, how many houses on the community. They're not going to go all the way to, say, Mutijulu
Yeah.
to do one house. So,
Unless, of course, it's an electrical issue.
yeah. Otherwise, yeah, it depends too on the problem, but waiting. But since I've been coming along and reporting on their behalf, jobs are getting done quicker for them.
Yeah. Is that because you think because you're reporting, not the actual tenant? Or?
Probably, yeah.
That's crazy.
Yeah, and also I'm sending, like I said, photos or videos to show them how, you know, bad the problem is for them.
Only asking because in Tom's speech yesterday, where they say they're really focusing on you can report it, us as the tenants can report it, nothing being done.
Yeah.
You go through an organisation that says supporting you, you know, but those same issues from 25 years ago still
happening.
Yeah.
And like I say to a lot of, when I do my talks, I always tell people, you know, your house is like your grandmother, because your grandmother actually puts shelter over your head, it protects you, but most importantly, it keeps you safe. So you have to learn to look after your home, because your home is like your grandmother. And that's what they. And mind you, some of those houses are old as the hill, and some of those tenants actually grew up in that house when they were babies. So they know how old the house is as well.
Yeah.
The other issue that we have here in the Territory is the fact that our government changes all the time. So when the government changes, so does the policy, and everything comes to a halt.
Do you send like reports, Michelle, you know, to say, hey, every 3 months or something or other, we reported this, it's now been 3 months, out of all these reports, you know,
Yeah.
Jack's been
Yeah.
done, more or less.
Yeah.
Yeah, okay, thank you. Thanks. Right, round of applause everybody.